Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch, presented by UMass Memorial Health Care. I'm Brittany Schaefer. Today we're here to talk about at-home colorectal cancer screening kits.
An at-home cancer screening kit for colon cancer is a kit that is sent home with the patient for them to send samples of their stool back to the physician to be tested for colorectal cancer. There are three different kinds that are currently in use today. The traditional one is the Fecal Occult blood test, which is a kit that's sent home with the patient. They test or they swab three sequential stools, and then they sent the kit in to the primary care physician's office and they test it for blood. With the indication or the meaning being that if there is blood, there may be cancer, and that should prompt further workup. The FIT test, which is an immune test, it's an antibody test to the protein in blood, is done with one single test of the stool in a very similar fashion, but all it requires is one stool sample. And then the newer test, or the Cologuard, which is the FIT test in addition to a DNA test, is done in a very similar fashion, looking again for DNA shed from tumor cells.
What are the advantages of one of these tests?
The number of people that are at risk and actually being screened is still not sufficient. So the theory is that if you increase the number of options available to patients, that they would comply and follow the screening recommendations. Thought is that if you have a test that's fairly simple at home, that can be done at home with minimal preparation, so the patients don't have to cleanse their whole colon, they're more likely to comply with the test and get it done.
What are the disadvantages of an at-home test?
The primary disadvantages are that while the tests are sensitive for picking up blood, they're not very specific. And you have to think that where the majority of tumors in the colon develop, they go through a sequence of polyp to then cancer. So a polyp, which is a precursor to a cancer, normally doesn't shed blood. So in theory, you could be missing polyps.
How effective are the at-home tests?
The sensitivity, meaning actually picking up something that is actually there, ranges anywhere from 60 to 80%. The problem is that they're not very specific, so meaning that actually picking up a cancer. So you could be shedding blood from an ulcer in your stomach and the test would be positive. For example, the fecal occult blood test would be positive, and you would then go on to get a colonoscopy, but there's likely not going to be a lesion in the colon because the bleeding was coming from the ulcer. So they're not very specific for colon cancer. They're just sensitive at picking up any sort of blood or DNA in the GI tract. The newer test, the Cologuard, is actually a little bit more sensitive because, again, it's combining two tests. It's combining the DNA with the antibody test. But the problem with that is that its specificity, or the ability to pick up cancer specifically in the colon, is actually less because it's picking up DNA, any DNA that's being shed from any tumor cell in the GI tract. So it could be a tumor cell within the small intestine or in the stomach.
Can an at-home colorectal cancer screening kit detect colorectal cancer in early stages?
Very early stages, or again, precancerous polyps, it's probably not as good, and it's been shown not to be as good as for later stages. And again, you're really dependent on the cancer shedding blood or the polyp shedding blood. So if it's not doing that, it's not likely going to pick it up.
How would someone take an at-home colorectal cancer screening test?
Usually it's done through the primary care physician's office. They order it. And usually insurances should at least cover some of the costs of the kit that can get sent home with the patient. Usually a lot of the primary care practices may have it in their offices to give out to patients when it's time, or actually write a prescription for the patients to pick up so that there's less out-of-pocket fees.
Is the at-home screening kit a first step in colorectal cancer screening?
The recommendations for screening are actually varied, and one of the reasons that there are so many options is to hopefully increase the number of people who are actually getting any screening. So while for some people, yes, this is the initial screening, it can actually, based on some of the recommendations, some of these bodies recommend, for example, if you're only going to get the stool test done, that is okay as long as you get it done on a yearly basis. Whereas if you have a colonoscopy, for example, you would have one colonoscopy. The recommendation is for an average risk patient to have one colonoscopy every 10 years. So these tests can be standalone, but yes, if something is found, further testing needs to be done, such usually a colonoscopy. Stool test that's done at the doctor's office, such as just a single stool sample, that's not sufficient. That only picks up about 5% of tumors. So if this should replace anything that's done in the office. This, as a standalone test, if this is going to be the standalone test, it can be as long as it's done the right way, which is at home with at least the fecal occult blood test needs to be 3 separate stool samples. If you do the other 2 tests, the FIT or the Cologuard, then it's just one single test, but it's done at home.